I'm live. Hello.
Setting up our technical.
Hey.
Listen, now you know they got your package at the house. They put it in the car.
Oh, they tell she ain't getting this. Hey, how you doing? Great.
So we're all here. Welcome to the When Education Meets Vision event, our very first event of 2019. So this is very, very special. My name is Raheem Whitehead, aka the Prince of Pads, and I'll explain to you later, where I got that nickname from. But just first off, I just want to say thank you for everybody coming out to this event. You definitely want to take notes or some video, because some information that you're going to receive today is literally going to blow your mind. First off, the way that I got involved where I'm here today is because I saw a video almost 2 years ago. And this video contained a lot of information about women's health, okay? And once this video, a little bit of time passed after I saw it, and it reached thousands and thousands of people because it struck a mindset with people that they may be doing things the wrong way, and then a solution was provided, and it sparked, and it just took off, okay? It grew so fast, it actually was faster than what our previous company could contain. It was just that phenomenal. So with the information, it's all about what you do with the information. So the reason you're here now is because we have an even grander vision to make this vision that we first saw a couple of years ago right. And with any vision, you have to continue to push forward to see it all the way through. So we're going to get some education, and we're going to get some vision. And I'm going to tell you why this event is very special, because it's very rare that you get two individuals in completely different industries come together and share, some information, because they're both at the top of their industry. They're the best at what they do. So just consider the privilege that we're here, and we're here on a small level. You're seeing the inception of a vision, because the vision always starts somewhere, right? And then it grows and it grows and it grows. So consider ourselves privileged to be able to see the inception of what's taking place. So without further ado, we're going to bring on Dr. Malloy. He has almost 40 years of experience in the, I hope I'm saying it right, the gynecology industry, healthcare industry. He has some more accolades that I don't even know about. I know it has some things to do with clinical trials, but he's a man of the community. He's a man of the community because what he's doing today, opening up his place of business and sharing this wealth of knowledge, he's doing absolutely free. We're doing absolutely free for us, because he also has a vision as far as improving the health of the community. So we're going to bring him on. He's going to share this information with us.
Yay!
First of all, thank you, Mr. Crump.
Yes, sir.
This is the honor for me, okay, and for everyone who's here. Let me tell you a little bit how I got involved in this area. I'm a gynecologist, as he said. I've been a gynecologist in the South DeKalb community since 1981. Well, that's a long time, which means I have seen a good number of women with a lot of problems. And when I first heard about the sanitary napkins and that, something that could benefit women, first thing I'm thinking of, okay, I also do research, and I'm going to do some research into what I'm hearing about to see if this is something that's real, or if this is just something, a ploy, okay, in a way to try to get some monies from our young ladies. So therefore, first thing I did was I did my research. And when I did my research, a lot of things that I learned about sanitary napkins, which I knew very little about, I knew very little about the process, okay, of how they actually made the sanitary napkins and the dangers in that process, okay? Because let's face it, you know, as a male, that's not something I thought about. As a gynecologist, I didn't realize, okay, to actually got involved that some of the problems and complaints that my patients actually had were probably related to the sanitary napkins. I never even thought of that. That was the last thing on my mind. And now it has educated me so that when I'm talking to patients and hearing what they're saying, I can actually say, hey, you know, what pads are you using? How often do you use them? Or are you also using tampons? So I can now add that to my questionnaire to get a better feel for some of the problems that they're having. So when I realized that there was a sanitary napkin that was not only better, when I say better, more effective, more efficient, and had health benefits, I just had to stay with it. I just had to stay with it, and that's why I enjoy being here, educating as many people as I can about what we need to do to improve our health, mainly of ourselves, of our children, and not only our children, but our grandchildren who may not even be here yet. Because as you know, once someone has a tradition, and that tradition gets passed on, or that education gets passed on, it gets passed on to even those who aren't here yet. Right. And that is extremely important. So most of you have seen the demonstration, that's why we're not actually doing it today. You know how well the pad works. But I tell people, when a woman goes to a store to buy a sanitary napkin, okay, she is buying something that is going to protect her because she's bleeding every month, sometimes 3 days, up to 7 days, and it's uncomfortable, it's bothersome, but it's part of something that she is going to do for 30, 40, maybe even 50 years, depending on when she starts and when she stops. So as far as what does she wants something that works, okay? And the reason, and I'm gonna go back and forth, okay, because for me to make it all make sense, I need to do that. The reason it was the advent of tampons is because the pads really were not effective for a lot of women, and especially African American women. And the reason I say that, because we have a preponderance of fibroid tumors, which contributes to our excess bleeding. And so therefore the pads that were out there, not only were they not working well, but they definitely were not doing what our women needed them to do. So a lot of women started using tampons almost like an insurance. Like, okay, let me do this to plug up things to slow the amount of blood that's coming out so that the pads that are on the market could at least maybe absorb that. So that was really the advent. Now, of course, with the advent came other uses, but that was mainly the reason why they came up with the tampons. Okay, getting back to the pads. So we know that the pads that we have are better. We know that. There's no question. You've seen enough demonstrations. You know enough people who have used them. That's not even an issue. But we have that special extra, that algae strip, okay, that's on that pad. Spend some minutes actually talking about the health benefits of that. Okay. Get it. When you buy a pad, you're buying it for its effectiveness. But you've heard testimonials, okay, you've seen the YouTubes, you've been to the conferences, you heard people talk about, hey, when I used these pads, my cycles were shorter, my cramps were less, I didn't feel as bad, I didn't have the odors, I didn't have the irritation, I didn't have the discomfort. You hear all those things and you're saying, well, how can a sanitary napkin, okay, do all these things? Okay, so of course, and when you're talking to your friends, relatives, and explaining about the pad, and you kind of mention those things, so like, come on, you know, really, how can a pad do those things? But it's hard sometimes to really talk about that algae strip because it is technical. It is technical, and I'm going to do my best. I'm going to try to break it down, and they'll see why those things that you hear about work. So we're going to start with the easy one, and that is nanosilver. Let me say, nanotechnology, let's go back a little bit, has really helped science, okay, do things that it couldn't do before because of the size. Okay, that algae strip, maybe it's about an inch, about a half inch, and you're saying, well, how can something that small do so much? That's because we have technology now that can break particles down to a billionth of the size and still have the effectiveness of something larger. So that strip, you can call it a fabric, you can call it an algae strip, is impregnated, okay, with three things. And nanosilver is the first one. I'm going to speak about that first. Okay, far infrared therapy, and I'm going to talk about that, and negative ions. So let's talk about the nanosilver. Silver, okay, there's an element that has been around forever. Okay, so that's nothing new, okay? But we didn't know until years ago, they didn't know that silver had a medicinal benefit. I like to call it an anti-infective, as opposed to saying antibacterial or antivirucidal or anti-trichomonal or antifungal. It's an anti-infective. And this is why when people have burns and they go to a burn unit, one of the first things that they do is they put Silverdene ointment on those burns, because the sooner they can prevent infection, the easier and better that wound will heal. So silver has been known to be beneficial as far as treating any type of organism that can cause injury or harm, especially in wounds. Okay. Another thing about silver, when people were eating with silver utensils, okay, they noticed that they had, again, we're talking about hundreds of years ago, they noticed that they had less GI discomfort than people who were eating with their fingers, or people that were eating with iron utensils, or people that were eating with wood. Again, they didn't know. They didn't realize that the silver was coming, part of it obviously was coming off onto the food, going into their GI system, and actually decreasing their GI discomforts that people who were using those other utensils. So again, they didn't know why, okay, but they noted that it did that. And that's why silver became such an expensive metal, okay, because they knew it had these benefits. Not to mention that it could be shaped into a lot of different things, but the fact that people who ate with that were like, hey, you know, I'm not having some of the same problems that someone else is having. So silver has been known. Matter of fact, some of your appliance manufacturers actually have nano silver actually inside of the wash machines and dryers, okay, so that it can fight the organisms that are on the clothes that you put in there, okay? Now again, they don't necessarily have big signs on it that they have that, but if you look it up, Samsung especially, they actually have nano silver, okay, inside the drums, okay, of their appliances. So we know that silver is an anti-infective. Now, let's take that to the algae strip, okay? You have this nano silver, okay? It's on the strip, okay? The strip is right next to the vagina, right next to the vulva. And if you know, that's the area that a lot of women will complain that they have irritation there right after their cycle. Then they have a little redness there, they may have a little swelling there, they may have a little itching, okay? And that's because, one, of the fact, just the irritation of the blood that's on that layer of skin, but also, we all know that the vagina has bacteria. It's supposed to be there. They keep a certain pH level that allows the sperm, in terms of someone procreating, it allows the sperm to live in that environment so it can go up into the cervix, into the uterus, out to the fallopian tubes, and cause fertilization. So the pH inside the vagina is supposed to be at a certain level, okay? However, that same bacteria that is normal and good, when it comes out of the vagina, now it's in a different environment. It's not in an environment of 98.6. It's not there being balanced by the yeast. It's there on its own, and it sits there, and it can now cause irritation. And then you have heat, okay? We know that heat also contributes to the growth of any organism. This is why, if you remember from when you were in high school and you in biology class, and they had those agar plates, they told you to take a Q-tip and like wipe the inside of your mouth, and then they had you wipe it on a little plate and you put it in a what? An incubator. And what did that incubator have? heat, okay? And the reason it had heat was they knew it would help the bacteria grow, okay? Well, when you think about it, the vagina, the vulva, actually acts like an incubator, okay? So therefore, you want to have an area that we know is prone, okay, for the exact milieu that you need to grow bacteria and organisms. So nano silver, being anti-infective, is sitting right there, okay, waiting for that bacteria to come out. And what does it do? It contributes to destroying a lot of it. Now, I'm not going to stand here and say it gets rid of all of it. No, okay, because there can be some areas where the blood is gone that's not where the algae strip is. But we know that those women who are saying that they're noticing decreased irritation, decreased swelling, decreased redness, that is primarily the reason for it. So that is where the nano silver has its benefits. So keep that in mind. Now, let's move on to the negative ions. And you guys have heard a whole lot about negative ions. You've heard people call them the vitamins of the air. Okay, negative ions are around us right now in this room. The thing about negative ions is it's like a antidepressant. It lifts your spirit, okay? What it does, negative ions, and ions are just invisible particles in the air, okay, that have either they're negative, they're missing an electron, or excuse me, they have an extra electron. If it's positive, they're missing an electron. So you have positive ions, negative ions. Your positive ions are what you would say your bad ions. These are the ions responsible for irritability. These are ions responsible for tension. These are ions responsible for odors, responsible for pet smells. And so when you're in your house and you smell smoke, or you smell your animal, or just, those are positive ions in the room, okay? Negative ions, what they do is they combine with the positive, and as you know, positive and negative get together, it's neutral, and they fall to the ground. So that's what negative ions do. Now, the other thing negative ions do, negative ions are also a vasodilator. What I mean by that is it dilates the blood vessels in the body. Okay, so if it dilates the blood vessels in the body, what does that mean? That means more blood can get to a particular organ, right? So you have the negative ions dilating the blood vessels, and by dilating the blood vessels, you're allowing more oxygen to get to the tissues, and therefore it's allowing the uterus, okay, to heal faster. And this is why one of the things that you hear people talk about their cycles being shorter, okay, that's the reason why it's shorter. Because what is a menstrual cycle? A menstrual cycle is nothing more than you not getting pregnant. I know that sounds kind of crazy, and I'm going to break it down in a second, but you have a menstrual cycle because you are not pregnant. Because guess what? When you are pregnant, you don't have a menstrual cycle. Okay, and now that's the simplification of it. What really happens is around the 14th day, okay, of the cycle, you make an egg. Okay, now the way the body is made, what happens is, since that egg has been made, it's left the ovary, it's going into the fallopian tube, waiting for that sperm. Well, let's face it, it's almost like if you're going to plant something in the yard, what do? You prepare the soil, okay, so that the plant will grow better. Well, the body is naturally set up to prepare that lining. It's getting thicker so that when that egg is fertilized and it goes into the uterus, guess what? It can burrow in, get fixated, grow the placenta, and then 9 months later, you have a baby. Now, so the lining gets thicker in preparation for this fertilized egg. Now, if you don't fertilize that egg, okay, you don't try to get pregnant, or you're not getting pregnant, well, now the lining is like, well, you know, we did this work, but we're not really needed because the fertilized egg never came. Well, we might as well go, okay? No sense staying here. And so you are sloughing after 14 more days when it realizes that there's no egg coming, you end up sloughing off that lining. That is a menstrual cycle. Okay, now, what happens is now it has to get that, it's like anything else. You have to now start all over again, and you have to get that lining prepared. Well, that process, okay, from bleeding to no bleeding, some women it's 3 days, some women it's 7 days, okay, it's, because that's what it's doing. It's all broken down Now it has to heal, and when it heals, you stop bleeding. Okay? Well, let's get back to the negative ions. If the negative ions are causing vasodilatation, opening up the blood vessels, and allowing more oxygen to go to the lining, that means that lining is going to heal faster. If it heals faster, that means that the cycle is going to be shorter. So that is one of the benefits, okay, of the negative ions. Now, negative ions do a lot of things, and I could probably give a whole talk just on negative ions, but I'm going to cover a few more things. You've heard some people talk about how they just generally feel better. I mean, most people don't say they feel better during their cycle, but you have some people who have used our pads and said, hey, I don't feel as irritable, I don't feel as uncomfortable. That's because, if you heard me about 5 minutes ago, I was saying that negative ions also act as an antidepressant. And what I mean by that, they've actually done studies where they've taken women, okay, who actually women and men, who were on antidepressants for depression. They had them in 2 different groups, and they took one group and said, you know what, we want you to stop taking your antidepressant, and we want you to use an ionizer. An ionizer is a machine that makes negative ions. Okay, so what we're going to do is we're going to have you use an ionizer in your house, and this other group, we're going to have you continue to take the antidepressants. Well, after 30 days to 3 months, I think it's the length of the study, they noted that the people who had been on antidepressants, who are now using an ionizer, felt just as good as they did when they were taking antidepressants. And that's because the ionizers, okay, produced the negative ions that got into their system, okay, and gave them a euphoric feeling, made them feel better. Okay, so that's why when you do hear people talk about they don't feel as irritable, as tense, as uncomfortable, that is the reason. Another aspect, and this is something that you guys want to think about next time you're in front of a computer, okay? All your electricity, okay, phones, tablets, okay, all of those instruments produce a lot of positive ions. Okay, now I'm going to give you, this is something that happened to me, and again, as a physician, don't think we know it all. We really don't know it all, okay? Because I didn't realize why I was all of a sudden having these headaches at night. I actually had the headaches in the morning. Okay, I had bought one of these fast chargers, and I put it right near the head of my bed, and I put my phone right there on the charger. Okay, and you know, therefore, and I use my phone as an alarm clock. All right, so I noticed, I said, you know, for some reason I'm waking up with headaches, and I don't get headaches. Okay, I'm waking up with headaches. I could not figure it out. I said, maybe something else is going on, maybe this is a warning for something else. And then I just happened. I was in the car listening to, I'm not sure if it was Dr. Radio or something on the radio, and this guy was talking about having all these instruments, tools, machines, okay, putting out all these positive ions, okay, and those positive ions were bombarding me and giving me the headache, because it was right next to my head. I mean, I had it right there. And so I said, no, let me see if this is really true. I took the charger, put it on the other side of the room, and I swear to goodness, the next morning, no headaches.
Wow.
And I said, wow, okay. And so this about the positive ions. And I'll tell you some other things. If you're working in front of a laptop has a different sort of rays coming from it than a PC. So if you're going to use one or the other, use a laptop, because a laptop puts out less positive ions than a PC. PC puts out a lot of positive ions. And this is why, at the end of the day, okay, you're working in front of a computer all day, you may seem a little irritable, okay, you're fatigued, you're drained, you lack of energy. That's because you have been bombarding the body with positive ions all day. Okay, one of the things that you can just put right on your desk, and what that portable ionizer will do, it'll send out negative ions, combat the positive ions, and you won't feel as bad. If you have a laptop, they even have now ionizers that you can put into the USB port, okay? Because they know this is a fact, okay? And the same with, like, I'm not, people have those, I don't forget what you call them, where you put it around your neck and you can talk it. No, I refuse to do something. After that experience with the charger next to my head, no, I try not to have any of those things around me. So is there something to think about? This particular person who was on the TV, on the radio, he was saying, he said there's no reason, and really when you think about it, it's true, to have your Wi-Fi on at night when you sleep. I set up an adapter where it cuts off. His Wi-Fi cuts off around 11 o'clock at night and comes back on at 7 in the morning. Because you really don't need it unless you get up in the middle of the night to use your computer or phone. And so why have your house being bombarded with all those positive ions when you really don't need to do that? So that's me, I thought it was a pretty good idea. So in the algae strip, the negative ions, okay, the purpose, as I said, they also act as a vasodilator, they act as an antidepressant, act as a euphoric device, okay, in that it's producing that good feeling. And this is why, and you've heard other people talk about when you're near the beaches, near waterfalls, mountains, okay, it's because, not just because of the production of negative ions, because water does that, but it's also the lack of positive ions. Okay, when you're actually in the water at the beach, there's no car right there, there's no PC right there, there's no fluorescent lights right there, and all of those things produce positive ions. So it's a combination of the production of negative ions and the lack of positive ions that makes you feel the way you feel. So negative ions, the last thing I'll say about negative ions, which I think is important, is in hospitals. You get ionizers, okay? In the American hospitals, ionizers are in your ICU, your CCU, your recovery rooms, and your ORs. Okay, again, they're there because they know the negative ions help with healing. So they want those negative ions in those particular areas, okay, where they know most critical, especially if you're in the operating room, your abdomen is open, your back is open, or your head is open, okay, you want the best atmosphere that you can possibly have. And in addition, think about it. I'm sure some of you have visited people in the ICU, okay, in CCU. You see more machines, okay, than you can even imagine, okay, people connected to everything. So that body is being bombarded with positive ions. So that's another reason why they put ionizers, okay, in those rooms. Now, in other countries, ionizers are in all the rooms of a hospital, okay, not just those particular areas. They're in all the rooms, but I know in the United States, they're mainly in those critical care areas. So negative ions definitely has a benefit, and that's one of the things that gives some of the things that you hear when they're talking about how they feel. Now, this last one is the one that's a little complicated, okay? And because I notice that when I've gone to presentations, sometimes people don't even talk about it because it's not the easiest thing to grasp, but I'm going to try to do the best I can. And that's the far infrared therapy, okay? The first law of thermodynamics is you cannot create energy, okay? Energy cannot be created or destroyed. It can be transferred, okay? Now, energy that's coming from the sun, okay, that thermal energy, okay, and the light that we see, there's a spectrum, okay? And you remember from elementary school that famous line, that kid named Malloy G. Biv, okay? Red, the colors of the rainbow, red, orange, yellow, blue, red, orange, yellow, green, blue, indigo, violet. Malloy G. Biv, okay? That's the colors of the rainbow. Well, when you get to the red, which is on this end, they've shown that when you ages of red therapy, okay, the far infrared therapy has been shown to have health benefits because it has a thermal quality. Okay, when I mean by thermal quality, heat. Okay, they can actually measure how much heat, how deep into the skin, okay, the heat increases when you have far infrared therapy up against it. All right, now we're gonna have some fun with this one. Okay, all of you in this room produce far infrared therapy. Each one of you, okay, because when you absorb it, from the sun. Remember I said, energy cannot be destroyed, it can only be transferred. So it's in your body. So this is why when you hear about palms on healing or Reiki healing, okay, a therapy, that's because you are transferring, okay, far infrared therapy into another individual. And you've heard about hands-on healing, okay, and you've heard that it works, okay, and the reason it does, the same reason why with the algae strip that's impregnated with far infrared therapy makes women's cycles, pains, and all not seem as bad. Because that heat, okay, is actually penetrating into the skin. And again, another aspect of both causing vasodilatation, okay, and it's acting as an anti-inflammatory. Now what I mean by anti-inflammatory, here's what I mean. Okay, Motrin, ibuprofen, Aleve, Advil, all of those are what they call NSAIDs, okay, non-steroidal anti-inflammatory drugs. If you can think of far infrared therapy as energy that has the capability of what the NSAIDs do, this is why women notice less cramping with our pads, because it's actually acting as an anti-inflammatory in the form of heat, and it works by several ways. One, we know what causes contractions. It's a chemical that your body makes called prostaglandin. It makes prostaglandin. It's the same hormone that when a woman is in labor and she's having contractions, prostaglandins, that's what's causing the contractions. Okay, the reason you take Motrin during your cramps is because it being an NSAID, okay, what it does, it stops the production of prostaglandins. Well, if you can stop the production of prostaglandins, then you decrease that chemical hormone that's causing the cramping. And this is why people take those drugs that I mentioned. And if you're going to take those drugs, the best time to take those drugs is before your cycle starts. Because once your cycle starts, then you've already made the prostaglandins. What you want is, you want those NSAIDs in your system to decrease the ability to make that prostaglandin, which causes the cramping. All right, so now, okay, what we have is we have that far infrared therapy, okay, that's acting like an NSAID in the form of heat. It's causing anti-inflammatory reaction, okay, because it penetrates the skin, goes into the skin, it opens up the blood vessels to the uterus, and therefore, women will say they have less cramping when using it. Now, again, it's not going to be every woman, and every woman is not going to have the same degree of relief, just like you can have 5 different women who take Motrin, and some will say, knock my cycle cramps out. Some other women will say, Motrin didn't do anything for me, okay? So it's not going to be the same, but the principle is the same as when you take Motrin, okay? That's with the far infrared therapy. Now, people have been using this for a lot of other areas. Again, there's nothing in our pads that's magical. Okay, everything that I've mentioned are things that have been used by somebody else in some other area. It's just that for us, we were fortunate to have a sanitary napkin that A, works better, okay, and B, has these health benefits that have proven themselves with other areas where they have used nanosilver, okay, negative ions, and far infrared therapy. Now let's speak a little bit more about the far infrared therapy. There's a little more. Okay, they actually have taken this technology, and for women who, let's say they're breastfeeding and they're not producing, okay, the amount of milk that they would like, they've actually made, okay, devices to put on the woman's breast, okay, that's impregnated with far infrared therapy. Because what does it do? It causes dilatation. It basically increases the oxygen to the breast tissue and therefore makes them work to the point of producing more milk. They also have gloves, okay, impregnated with far infrared therapy for people who have arthritis. and right now it's phenomenal, which is almost like a numbness that you have in your hand. Okay, so again, these are proven facts. It's easy to look and see all the things that those 3 things that are in the algae strip have been shown to help health-wise. So the great thing about pads, as I said, is you have these benefits that have been proven to work. Okay, now we have an understanding of how, we have an understanding of why. Okay, and to me, it's a no-brainer for someone to use our pad because, okay, effectiveness and health benefits. Okay, let's face it, our women have to use these pads for who knows how many years. I said in the beginning, it could be 30, 40, 50 years, okay? And we know that the pads that are on the market, okay? Now I'm gonna spend a few minutes, okay, just saying a little bit about that. The pads that are on the market, okay, no one challenged, well, I shouldn't say no one. People have challenged, okay, the health and safety of the pads. The problem that we've come across is that when legislation has been attempted, okay, it's always been fraud, it's always been knocked down. Fortunately, with this new Congress, the 116th, with as many women that are in the 116th now, we may actually start to see, okay, legislation making the major companies, okay, that produce those ineffective, unhealthy pads, okay, to now explain themselves. Okay, and one thing that you will see, and I saw this about 6 months ago, you've heard about dioxin. Okay, you've heard it probably ad nauseum, okay? And you know that it's a carcinogen, okay? The FDA does not dispute that dioxin is a carcinogen. A carcinogen is an agent that can cause cancer. But the FDA's position has always been that there probably isn't enough dioxin, okay, in the pads to cause harm. Well, first of all, there hasn't been any true blinded clinical trial to show or support what they're saying, okay? It's just a conjecture, okay? That's all it is. Plus, how do you know how many pads Lady A uses versus how many pads Lady B uses? Okay, how do you know how long? Okay, so to do the study, it would have to be an exhaustive study. So therefore, since no one has done one, okay, the FDA can just make a blanket statement that we don't feel that there's enough dioxin to cause a problem. Now, where does the dioxin come from? Okay, rayon and ingredients like that, okay, wood pulp, okay, it's not white. It's not, okay? But to make it white, you have to bleach it. It's the same reason why you use bleach in your clothes, your white clothes, to get the dirt out, to keep them white. Okay, so part of the process of making something white is doing the chlorination. Okay, and the chlorination with the wood pulp, okay, making it white, okay, that process, one of the byproducts of that process, you get a chemical called dioxin. Okay, so that's why dioxin is in those sanitary napkins, because to make them white, they had to do that. The point I'm making, and I realized this about 6 months ago, if you now go into the stores and look at some of the packages, okay, on some of the pads now, okay, you will see, it'll say non-chlorinated process. And that all started after we came on the scene. They didn't have that on the packages. You didn't see that on the packages, okay? But if you go and look, you'll now see on some of the packages that they have non-chlorinated process. Why did they, why? They've been doing it that way, okay? It's because of what we're doing right here. We're educating people as to what's out there, okay? We're educating people as to the health hazards, okay, that we've been subjecting ourselves to. Okay, and it's like anything else. Okay, even like the tobacco industry. Okay, tobacco industry. They knew that the nicotine was addicting. They knew this. Okay, that's how they made their money. They wanted you to smoke because once they got you smoking, you're going to keep smoking. Okay, and they still make the cigarettes, but okay, the FDA, Surgeon General, has allowed them to put that little message on the side. So it's like, buyer beware. That's really what it's saying, buyer beware. Okay, you know, you buy at your own risk, use at your own risk. Okay, even though, okay, for them to put that there, they're saying that it's harmful, okay, but yet people will do it, they'll still, but you know, what can, you know, Reynolds can then will say, look, we say, but you know, we can, what do we do, stop them from buying it? Okay, the only thing that can stop this if someone stopped them from making them. And as you can only imagine, the lobbyists that those tobacco companies have enough to choke a horse. Okay, so no, they're not going to stop making cigarettes. That's out. Okay, so I can go on, and I think that I've covered this as much as I feel I should in this time frame. But if anyone has a question or questions that they want to ask me, you know, feel free to throw them at me. You know, answer them the best of mine.
Dr. Malloy, I did have, first of all, thank you for this. This was some insightful information. For me personally, I got some serious notes here and things you educated me about our product. But I want to ask you this. You start off, you're speaking in the beginning of fibroids. What is one of the main causes of fibroids in women, and especially African American women? Because I've noticed, not only going around the country, but going around the world, you know, women of color are really, really plagued with fibroids. And what would you say is a contributing factor that's common or universal from your experience, you know, that relates that to women of color?
And that's a question that you can imagine all gynecologists are asked all the time. I wish I could stand here and say, this are the reasons why people have fibroids. It's really multifactorial, okay? When I say multifactorial, there are a lot of potential reasons, okay? Some of them genetic, okay, some, but we do know that a lot of white women will have fibroids, a lot of Asian women will have fibroids, so we know it's not exclusive to African American women, but we know that African American women have a greater percentage and their fibroids are larger, okay? So we know some of it's genetic, some of it is dietary, okay? And again, I can't stand here and tell you what percentage goes with diet, what percentage goes with genetics, but we do know that some of it is related to diet. There could be other factors in the environment, okay, that could be contributing to it that we're not even aware of, okay, we don't know. But we do know that estrogen supports fibroids. Now that we know. And that is why when women, okay, a lot of women don't even know they have fibroids until they're pregnant, okay? And during the course of the pregnancy, or after the pregnancy is over, the doctors will say, hey, you have fibroids. And you're like, well, no one ever told me I had fibroids before. Because in pregnancy, the woman makes a tremendous amount of estrogen during the pregnancy. And so we feel that that is a catalyst to whatever may have been the precipitating factor. Okay, again, we don't necessarily know. All we know is that a fibroid, and let me educate some people, guys probably know all about it, let me say something about fibroids. A fibroid is not something that has come to that uterus. Okay, it's not like getting something. Let me put it that way. Your uterus is a muscle, and they're muscle fibers, okay, make up the uterus. One of those fibers wakes up one morning and says, I'm going a different direction. I'm going to become a tumor. Okay, so the fibroid is actually one of the muscle fibers of the uterus that decides to change, to mutate, and become a fibroid. The factor, to answer, no one knows for sure why that happens and when it happens. I've had patients that at age 25 had 25, 30, 35 fibroids. Okay, I have one patient of mine that I have done 3 myomectomies on her. Because I'm kind of anti-hysterectomy, so I will take out, I've taken out, I think the largest number, I've taken out 60-something fibroids, okay, out of my uterus. Okay, I'll spend, I'll give us 3-4 hours in the OR, okay, taking out every fibroid to save that lady's uterus, okay. And I've had this one patient, I've had to take her to the OR 3 different times, okay? Because A, she had no children, and she said, Doctor, please do whatever you can to save my uterus. I said, fine, okay? But her fibroids grew that fast. And when I take out fibroids, if you can see it, I take it out. And some docs will take out just those fibroids that are large, they kind of leave the small ones out. I take out every single fibroid that I see. And yet, 3 times they grew back, okay? And so in her case, we knew that estrogen, okay, at least from a pregnancy, wasn't stimulating her because she never got, she didn't get pregnant in between those times. Okay, so we're not sure why, but we know estrogen stimulates her. This is why, if I have a patient who's near menopause, okay, let's say she's in her upper 40s, early 50s, but still having some cycles, but she has fibroids, and I'll say, don't do anything. Don't do anything. I said, because once you become menopausal and your estrogen levels drop, those fibroids are going to shrink, okay, and we see that. We've had patients with large fibroids, and the further they're into menopause, okay, the smaller that uterus becomes because it's less and less estrogen over time. And speaking about menopause, since that's actually my area of interest, women are going to be living half their life in menopause, okay? Because I'm sure a lot of you have relatives, co-workers, church members that are 100, up in 90s, okay, 50. That means that she spent 40, 45 years in menopause. She spent more years in menopause than she did during her reproductive years, okay? And we're going to see more and more of that. So to me, if I have someone who has a fibroid and they're near menopause and they don't want to do anything, I say, don't do anything, okay? Because they're going to shrink as your estrogen levels start to go down. And another thing, we've seen people with birth control pills. Now, fortunately, the birth control pills that are out on the market now are not the high-dose pills that are out when I trained. Okay, when I trained, those birth control pills were like literally 10 times the strength that they are now. That's why if you talk to your mother or grandmother, she'll talk about people that took birth control pills back in the past and had strokes and all that kind of stuff because the estrogen levels were so high, okay, it contributed to those things. Now, the birth control pills have very little estrogen in them. So we don't see as much fibroid stimulation, okay, with birth control pills as we used to. But to answer now, and then when I say this, getting back specifically, because I can go off into tangents. Okay, back to your specific question. There probably are some environmental issues. Okay, where the environmental issues in the air, or whether there are environmental issues in the food. Okay, we don't know. That could be contributing, okay, to the fibroids. The problem then becomes if Miss Jones is breathing the same air that Miss Smith is, okay, here we go again, and Miss Jones is white and Miss Smith is black, then why is Miss Smith getting fibroids and Miss Jones is? That's what I'm saying, it's multifactorial. It's probably a lot of reasons.
Well, one of the things I want to ask in addition to that as well is because obviously a lot of these discussions we had behind the scenes, we can't talk about it publicly because we can't be looked at to say our product possibly could heal anything, mitigate any issues. So we got a fine line we got to be able to draw in reference to that. Even I was on the phone with the attorney today who I'm hiring with the new company, and we were going over some dialogue, different things and some things I'm putting together that I was getting clear to make sure it's right. So here's where I'm going with this second question. But behind the scenes, there's been conversations that potentially tampons can help contribute towards fibroids because it's keeping that blood backed up inside of a woman rather than it being extracted from her body, because the tampon is acting like a plug and it's keeping that blood and those toxins locked in. So I just wanted to get your medical perspective on that, being an expert in this field.
Okay, now that's a whole, now you open up a
That's what I want to get further. You're not going to talk about that. I see let's talk about
me and tampons. Okay. Way before I even did research, okay, I've never been a supporter or proponent of tampons because to me it just seemed so everything on your body is there for a reason. Okay, you have only one brain, you have one heart, you have one liver, okay, for a reason. Okay, but you have two kidneys, two arms, two legs, two eyes for a reason. You have two, because you can lose one of those and keep moving. Okay, so the body was there, and everything that's there is there for a purpose and a reason. Blood is supposed to come out of you, because as I said earlier, if the person doesn't get pregnant, okay, the lining says, I don't need to be here. Okay, I need to go. I need to get out of here so we can have a fresh lining. Okay, maybe she'll get pregnant this next cycle. But I'm old, I wasn't needed, I need to leave. Okay, and as I'm leaving, I'm gonna be picking up bacteria, okay, on my way out, because there's bacteria in the vagina that's supposed to be there. So I'm gonna carry that right with me on the way out. Now, you have something that says, oh no, hold up. Blood, bacteria, stay there. That does not even make sense. Okay, blood, bacteria, I don't want you to stay around. Okay, I don't want you to come out. Okay, well, here we go now. We got man going against nature. Okay, and nature always wins. Okay, as I was talking earlier about all this rain we've been having. Oh yeah, I can complain about it. I can't do anything about it. Okay, because it's going to come. Or it's not going to come. So we now want to try to control what nature is saying is supposed to happen. And that's why it can be fraught with nothing but disaster and problems. Okay, because you're going against what is supposed to happen. So now you have bacteria that's supposed to come out with that blood, that now, because it's sitting there, okay, you have this tampon, it's like a smorgasbord. The bacteria sees all this blood, instead of the blood coming out, okay, the bacteria sits there and says, well, take a little bit here, take a little bit here, take a little bit here. And what did I say in the beginning of this conversation about what did you do with those agar plates? Those were called blood agar plates. The reason they were called blood agar plates because they knew that blood has all the nutrients to allow bacteria to grow. That's why you wipe your mouth, you put it on the blood agar plate, and you put it in an incubator. Tell me how that's any different, really, except for the swab, than the vagina. Okay, and so now you have this tampon, you have this device that's up there, okay, letting the bacteria grow, and then the bacteria, let's face it, it has to go somewhere, okay, it has to go somewhere. So what does it do? It goes into the walls. It just goes into the walls of the vagina, or it goes back up into the cervix, it goes up into the uterus. God only knows what that bacteria grows in minutes, Okay, now it's all over, inside the vagina, up in the uterus, and when it gets into the bloodstream, it then becomes toxic, okay, or septic. And this is why you have toxic shock syndrome, okay, because you have done nothing but you've gone against nature, okay. So man has contributed to a disease that did not have to happen. Yet use tampons, just like the Surgeon General written on the side of the package, cigarettes, they'll still smoke. So yes, okay, the bacteria going back up into the uterus, God only knows, okay, anything from sterility, okay, because if that bacteria gets out and has an effect on the fallopian tubes, okay, it can make the fallopian tubes not act or work the way they should, okay, endometriosis, okay, because now you have the blood, okay, that's backing up, and that blood has to go somewhere, okay, and what is endometriosis? It's nothing more than the lining of the uterus. All endometriosis is, and if you I think they were talking about, I saw them talking about dioxin. I was saying earlier about dioxin being a carcinogen. They also have shown that there's an association with dioxin and endometriosis. Okay, there's an association between them. Okay, so now you have that tampon that's allowing that bacteria to go up into the uterus, into the walls, and so it can cause who knows how many problems. You know, and chiefly pelvic pain. When a woman comes to the doctor's office and has pelvic pain, now, okay, there is an array of things that can cause it. And now, some docs, which may not have done before, because I can assure you, 5 years ago, I would say, no, let's not even say 5 years ago, 2.5 years ago, okay, before we got out here and started educating, okay, women about our product, okay, and she was talking about pelvic pain. I mean, you may have had some, but the average doctor probably didn't ask. I'm sure that these women would probably state that they've gone to their gynecologist, and the gynecologist probably hasn't asked them at all. When they went in there, maybe talking about pelvic pain or problems of vaginitis or whatever, or using pads or tampons. Okay? But yet, we know that it's so obvious. God, the worst thing that a woman can use, by far.
One of the things I found out in sharing in focus groups with women about this is that most women simply, first of all, there's a lot of women, they know tampons are unhealthy. It's almost becoming undebatable. They use it for convenience.
Well, yes.
The biggest reason in the pad multiple times throughout the day, they don't have to feel a lot of the wetness and moisture, because of the inferior makeup of the pad on the shelves. One of my things that I'm saying is, it's becoming a almost undebatable issues about whether it's healthy or not. Most women have just decided to go with it for the convenience.
Exactly. And I said, when I started talking, I said, how did tampons come into society? Because the pads were so inefficient, okay, that the woman, and mainly, like I said, African American women, because for the most part, we're probably, if you take the average African American woman, it's going to have probably more bleeding than any other ethnic group, because we're going to, for the most part, have fibroids more than